All right, Janice. So as we kind of already talked about, and from our evaluations and from our conversations with the physician, we believe that you have impingement syndrome. Impingement syndrome can have multiple causes, but is usually characterized by pain in the shoulder with overhead movement. The important muscles for this condition are on your shoulder blade, called the rotator cuff, and they're being pinched by a part of your shoulder blade called your acromion. This is one of the reasons that the pathology is called impingement syndrome, because the muscles and tendons are being impinged or pinched by the bone, and the muscles aren't able to move properly. So the rotator cuff is a group of 4 muscles that go from different parts of your shoulder blade to the front and attach on the front of your shoulder on your humerus. Impingement syndrome can have multiple causes, and sometimes people have hooked acromion, or they have and basically they have a hooked acromion, but from your X-rays you don't have that. But what's going on is but it is similar to other parts of the anatomical, where there's less space between where your rotator cuff muscles come through and where the acromion is, because of your posture and positioning. So impingement syndrome can also just be caused by overhead motion at the repetitive overhead motion at the shoulder. And with swimming, you're doing a lot of that in your stroke. And because of this repetitive overhead motion caused by a stroke, your rotator cuff muscles have become very fatigued and tired, and they've developed many trigger points throughout your rotator cuff and your other parts of your shoulder musculature. So trigger points develop when the muscle is overused. If the muscle is constantly being used to hold on to that body position, that posture, then the muscle is not getting blood flow. And without the blood flow, the muscle can't get oxygen, and then the muscle can't relax. It's constantly tense. So it's in a constant state of contraction, which then causes pain. As these trigger points develop, the body is constantly adapting, and you're kind of constantly changing your motion and stuff like that. So we kind of need to work on those trigger points to kind of reverse this whole process, get your posture in a better position. What questions do you have? Okay. So in order to, so the first step we talked about is we need to reduce the pain and the trigger points that are throughout your shoulder musculature. The next step is to adjust your posture, and then we can also work on your stroke so that your shoulder muscles can kind of relax and further trigger points do not develop. By adjusting these items, we can start to reduce the space between the rotator cuff and the acromion by having the muscles in the right position. So as we also kind of discussed a little bit, we agreed that we kind of want to treat the trigger points, and we agreed that manual therapy technique might be the best application at this time for our treatment goals. So I want to give you a couple options. So the first option is the positional release technique, or strain counterstrain. It involves placing your affected musculature in a shortened position or holding it for a certain period of time so that muscle can relax and the oxygen can go back. The good thing is that with this treatment, it's fairly non-invasive. It does not take a lot of work. Just relaxing, putting it in a shortened position. It's usually pain-free. The risks are that with your, because of your pain, and you have all the pain in all these different muscles, that by shortening one muscle, we can also be lengthening another. So we may not get the desired treatment effect. The other thing, it's not really recommended to immediately go and do activity after doing this technique. Another one would be a trigger point release, which involves applying manual pressure to the trigger points. The manual pressure should cause the muscle to release and relax. This has been used a lot of times. It's been shown to be effective in the treatment of trigger points. However, you're really sensitive to the touch, even with a little bit of pressure. So that may cause you a lot of pain. And also you could have pain afterwards as well. And then the option would be the active release technique, which is similar to a trigger point release because there's pressure applied at the trigger point. But first, it's placed into a shortened position, similar to the positional release technique. And then you actually move your arm into a lengthened position after I apply the pressure. It's meant to treat those adhesions, those myofascial trigger points along with other things. Good thing about it is it's almost kind of like a diagnostic technique. We're going to kind of see where that pain is in your overhead motion. We're going to treat that specifically. And then it can also work by using your muscles. It can actually reduce the pain a little bit because you're focusing on your muscles firing, and then your pain sensors aren't freaking out as much. It's also I've also shown that there's a lot of positive effects after a few treatments. Once again, it could be kind of painful, and it also involves some work and coordination between me and you. So we kind of need to be on the same page and that we're working together and constantly communicating. And there's also it could have some risk of numbness and tingling. Okay, so you want to do the active release technique. You think that would be the most effective? Great, awesome. Yeah, I think that's a good choice, and it'll help to kind of help your muscles relax by having you do these movements. So we're going to first start our treatment on your supraspinatus, on the tip of your shoulder, because that is where you have your most painful trigger point is. The process goes through that we're going to place that muscle into a shortened position. I will apply pressure to the area, and when I tell you to, you're going to rotate your arm, and then we're going to repeat this process about 3 to 5 times, and we're going to hold that for about 5 to 20 seconds each time. So just so you know what to feel, you might experience some pain, like I said, and you also kind of might feel like a stretching sensation. It's important for you throughout the process to try and focus on your breathing. Try not to tense up. Focus on having the movement smooth and try not to have like a very jerky movement. If you feel numbness or tingling, let me know. That sensation can happen and can be normal, but it's good to know if it happens. And just overall, we'll just have to be in constant communication about how you're feeling, and you need to let me know if anything feels different. After the treatment, I'll give you some exercises that you can do at home. And maybe some things before you swim and after you swim. You also might feel some numbness or tingling in that treatment area. If you do, less likely, but please let me know. There's a small chance. So overall, I kind of hope that by treating these trigger points and working on your posture, we can get your shoulder blade and rotator cuff muscles in the right position. We can then work on your stroke, so we have a long-term effect in that you no longer have pain. That's kind of the main goal. So let's do it up.